Hello, this is Dr. Maha from Madella's Medical Videos and Podcast. And in today's episode of Ultrasound Must Knows, I'm going to talk about a very important and life-saving technique every doctor must know. And that is FAST. So what is FAST? Focused Assessment with Sonography for Trauma, commonly abbreviated as FAST, is a rapid bedside ultrasound examination that is commonly performed by surgeons, general physicians, emergency physicians, and even certain paramedics as a screening test for free fluid or blood around the heart or from the abdominal organs, hemoperitoneum. The four classic areas that are examined for free fluid are the perihepatic space, also called Morison's pouch or the hepatorenal recess, the perisplenic area, the pelvis, and the pericardium. This technique, it is possible to find any intraperitoneal or pericardial free fluid, which is usually due to trauma. Another ultrasound must know is concerning a very important organ that I'm going to talk about today, which is liver. The liver, as we know, is divided into right lobe and left lobe. First of all, let's talk about the normal ultrasound findings that concerns the liver. The right lobe of the liver, normally the size can reach up to 15 centimeters, whereas the left lobe is up to 10 centimeters. The normal ultrasound findings of a healthy liver is that, number one, the outline is smooth. Number two, it has a very homogeneous echo texture. Number three, it is echogenic or slightly brighter than the kidney. These are the main three things from which we usually identify a healthy liver. So these 4 points are very important. It's the size, is the outline, the echo texture, that is homogeneity, and the brightness of the liver. Liver diseases. Now, trying to make things simpler, the liver diseases can be divided into diffuse liver diseases, in which the whole liver can be seen affected with the help of ultrasound. And this further can be divided into the liver diseases in which the liver will appear brighter, and the liver diseases in which the liver will appear darker. Diffuse liver diseases in which the liver will appear brighter as an echogenic is number one, the fatty liver disease. Number two, the liver cirrhosis or fibrosis. Number three, granulomatous diseases such as TB and sarcoidosis. Number four, primary biliary cirrhosis. So these are the four diseases in which the liver will appear diffusely brighter or echogenic. On the other side, the four most common diseases in which the liver will look darker or hypoechoic is number one, acute hepatitis. Number two, liver congestion due to heart failure. Number three, leukemia. And number four, lymphoma. Now let's talk about the fatty infiltration of the liver. When can I call a liver fatty liver? It's when fat accumulation exceeds 5% of the liver weight. Ultrasound findings of fatty liver. Now let's compare the same points that I spoke about, a normal liver from a fatty liver. The size of fatty liver is usually enlarged, so enlarged size of liver. Number two, the shape of the liver. There will be usually blunting and rounding of the margins and the angles of the liver. Number three, there will be diffuse increase in the parenchymal echogenicity of the liver. Number four, fine echo texture will be seen. And number five is the ultrasound grading of the fatty infiltration. So we have grade 1, mild, grade 2, moderate, grade 3, severe. Number one, diffuse increase in the fine echoes is seen very slight in grade 1, whereas moderate in the second grade, grade 2, and marked in grade 3. Visualization of the intrahepatic vessels and the diaphragm. In grade 1, there will be normal visualization of the intrahepatic vessels and the diaphragm. In grade 2, there will be slight impairment in the visualization of the intrahepatic vessels and the diaphragm. In grade 3, there will be poor or no visualization of the intrahepatic vessels and the diaphragm. Number 3 is the visualization of the posterior portion of the right lobe of the liver because of the sound beam attenuation. It is normal in grade 1 and 2 with no visualization in grade 3. The other form of fatty infiltration can be seen more focal. So there is another type of fatty infiltration called as focal fatty infiltration. Now, the most common sites of the focal fatty changes is seen near the gallbladder, the portal vein, and subcapsular. They are usually very sharply outlined, geographical or wedge-shaped pattern, normal intervening hepatic parenchyma, and no space-occupying effect. The ultrasound findings of the acute hepatitis. So let's talk with the same pattern. Number 1, taking the size of the liver, enlarged size of the liver. There will be increase in the size of the liver with acute liver hepatitis. Number 2, there will be diffuse decrease in the parenchymal echogenicity of the liver, that is hypoechoic liver or a darker appearing liver. Number 3, increase in the echogenicity of the borders of the liver and the portal vein borders, giving the starry sky appearance. Number 4, there will be marked edematous thickening of the gallbladder wall. Chronic liver disease. Now let's talk about the ultrasound features of the chronic liver disease or the liver cirrhosis, CLD. Number 1, decrease in the size of the liver, as in shrunken liver, outline. Number 2 is the surface nodularity or the irregular outline. Number 3, coarse or heterogeneous echotexture. Number 4, there may be segmental hypertrophy or atrophy. Number 5, we might find signs of portal hypertension, which is increase in the portal vein diameter more than 13 millimeters, or portal venous thrombosis, or cavernous transformation, or enlarged superior mesenteric vein and splenic vein diameter. We can find recanalization of the para-umbilical venous flow or the portosystemic collaterals. Another findings that can be seen with chronic liver disease is splenomegaly, ascites. Fatty changes or regenerating nodules can be seen sometimes, which are usually located at the periphery. Ultrasound features of liver congestion, usually due to heart failure. Number 1 is the increase in the size of the liver. Number 2, hypoechoic liver parenchyma. Number 3, increase in the echogenicity of the liver borders and the portal vein borders. Number 4, dilated hepatic veins. Number 5, loss of the luminal collapse of the IVC in response to expiration. Number 6, right-sided pleural effusion. Now that's all for today's episode. We will continue with more topics related to liver in other episodes with Ultrasound Must Knows. See you in the next episode.